Hi, I'm Dr. Leroy. I'm a dentist at Orchard Scotts Dental, and today we're going to be doing a smile assessment. So at Orchard Scotts Dental, we use an 18-point framework to assess your smile. So we go from macro, mini, micro. Today we're going to be talking a little bit more about the mini component. So this patient, if you notice, he actually has a pretty nice smile. But if I were to improve something, I would want to improve the balance. Because we don't really need to make the smile completely symmetrical because faces aren't symmetrical, but we want them to be harmonious and proportionate to the face. Another thing that we sometimes see would be what we call the buccal corridor. So the buccal corridor refers to this space that you have on either side. Okay, it's kind of like the negative space between the teeth and the side of the mouth or the cheek area. So if you notice, the front two teeth, they're kind of swung this way. And I also see that the teeth on this area, they seem to be a bit more hidden compared to the teeth on the right. So in this case, what I would do is I would probably make the teeth on his left-hand side a bit fuller because I'm seeing that there's a lot of negative space over here on this side compared to over here where it's a little bit fuller. So if you look at the smile curve, and if I join kind of like the edges of the teeth together, I think here looks good, but here looks a little bit deficient to me. And if I were to do a smile makeover for this patient, I would probably make the teeth on this area a little bit longer to kind of compensate for the lack of length and the lack of volume. So I might not really add too much on the right, I might keep things around the same, but I might improve the left so that it looks better as a whole picture when we look at him from afar. So this is a special photo that we take called a 12 o'clock shot, which tells us whether we can afford to add volume to the smile or not. So we're looking at the wet-dry line of the lower lip, and we're looking at where the edges of the teeth line up with respect to that line. So if the edges of the teeth are like already around where that line is, we don't really want to go further forward because that could make the smile more prominent, too protruding. But if the edges of those teeth are really like behind where that line is, we know that we can safely add volume to the smile so that it looks fuller at that area. And in this case, you can see that there's quite a big discrepancy between the left and the right. He's quite okay on his right-hand side, but on the left it's really deficient. So that's kind of part of why his smile looks a bit imbalanced when you look at him from afar.